the New Jersey Center for Tourette Syndrome and Associated Disorders, NJCTS, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any particular treatment. You are responsible for your own medical decisions. Now, I'm going to turn over the introductions of our speaker to Martha Butterfield, the webinar coordinator of NJCTS. Marty?
Thank you, Kelly, and good evening, everyone. Thank you for joining us. Before I introduce tonight's presenter, I'd like to remind everyone that our monthly phone-in support group meets tomorrow, February 25th from 7:30 to 8:30 p.m. Eastern Time. You can call our office at 908-575-7350 to register. This is an opportunity for families living with TS to talk to other families about their experiences. A broad range of TS topics are discussed. Also, I wanted to let you all know that we are experiencing some severe weather here in New Jersey. If we lose our power here in the office, the webinar will end. If Dr. Buonadonna loses power where he's located, he will reconnect to us via his cell phone and we will be able to continue the webinar. Now to the introduction of tonight's presenter, Dr. Joseph Buonadonna. Dr. Buonadonna received his undergraduate degree from LaSalle University, his master's in special education and school psychology, and his Ph.D., all from Temple University. He is a licensed psychologist and certified school psychologist in both New Jersey and Pennsylvania. In Marlton, New Jersey, he maintains a general practice treating children, adolescents, and adults. He has an extensive background in the field of education as a teacher of exceptional children, educational diagnostician, learning disability specialist, school psychologist, and administrator, and has worked with special needs children ranging in age from 4 to 21. Dr. Buonadonna, welcome. We're delighted to have you become part of our webinar programming. And now I'll turn tonight's webinar over to you.
Thank you, Marty, and welcome everyone. I want to thank you for joining us tonight for this presentation sponsored by the New Jersey Center for Tourette Syndrome and Associated Disorders on Understanding Behavior, a Guide to Behavior Management. As we begin tonight's webinar, I would like you to think about what some of your goals might be for this workshop. What do you want to learn from this presentation? You might take a moment and just jot down any questions that you might have, and hopefully at the end we'll have adequate time to address them. The questions that you might want answered. What did you hope to leave with today? I hope you have come with some goals, and I hope we can satisfy meeting most of those goals before this time together is over. I've also set some goals for us for this evening, and basically I have 4 goals for this presentation. First of all, I'd like to help differentiate types of behavior as appropriate, inappropriate, problematic, and pathological. Secondly, I'd like to help identify various theories for understanding behavior. I would like to reflect on how our personal biases and beliefs influence our responses to behavior. We all have our own biases and assumptions about why people do the things they do, why they behave the way they do. He only wants attention. She's crying to get her way. He isn't feeling well. She's worried about not being prepared for the test today. And all of these assumptions that we make about behavior tend to influence the way we respond. So I'd like to try to conceptualize how that impacts our ability to manage behaviors when necessary. And finally, to develop a model, hopefully a practical model for you and a strategy for managing behavior. With these goals in mind, I'd like to start the presentation by just looking at some of the faces that I think we've all seen from time to time, things that maybe we've encountered in our own lives, with our own children, in our schools, in our practices, and these are the faces that we see on a daily basis. So the question becomes, when we're talking about behavior, what are we talking about? Because behavior is a very complex and varied concept. There's annoying behavior, bad behavior, problematic behavior, misbehavior, unacceptable behavior, out of control behavior, good behavior, pathological behavior. There are so many different ways of seeing behavior and so many different types of behavior that it's going to be important for us tonight to try to figure out a way to differentiate behaviors. So for the purpose of our discussion, I've chosen to differentiate behaviors into 4 categories. These are not all clinical constructs, but I believe this paradigm will be helpful in my communicating with you tonight. We're going to look at appropriate behaviors, inappropriate behaviors, problematic behaviors, and pathological behaviors. First of all, let's get some definitions. Appropriate behaviors are generally acceptable behaviors for the child's developmental age, his or her culture, a specific environment or circumstance, and appropriate behaviors may or may not be bothersome. For example, for a 7-year-old, the expectation might be that we would hope that they would raise their hand in class before answering a question, while for a 4-year-old, it might be acceptable to call out an answer in preschool. The hungry 2-year-old who's crying for a cookie in the supermarket, while this might draw attention and embarrass the parent, it is not inappropriate, whereas the 15-year-old who might have that same kind of reaction would certainly be inappropriate. Inappropriate behaviors then are those behaviors that may be out of place for that child's age or an individual's age, unacceptable in a particular culture, specific environment, or unacceptable an unacceptable response considering the circumstances that are at hand. For example, an obvious inappropriate behavior at any age is someone standing telling jokes at a funeral. When we go to watch a movie at a movie theater and someone's talking on the phone, we consider that to be inappropriate behavior. Problematic behavior, also inappropriate, but these are responses that are more extreme than warranted, that become more frequent, or that result in unhealthy outcomes. But they're responses that can still, they're behaviors that can still respond to controls and interventions. An example of a problematic behavior might be a 4-year-old preschooler, let's say, who has a toy taken from them by a classmate and then bites that classmate on the arm. Clearly a problematic behavior. Not necessarily one, however, that we would consider to be more severe if we can intervene, instruct the child, and oftentimes those kinds of behaviors are behaviors that we can clear up fairly easily. And finally, in this design, we have what we call pathological behaviors. These are behaviors that are consistently unhealthy, that are harmful to oneself or to another, and effectively they are out of the control of the individual. Chronic drug use, alcohol use, cutting, eating disorders, anxiety and mood disorders are oftentimes conceptualized as pathological behaviors. Some thoughts to consider when we are thinking about differentiating between behaviors. Not all behaviors are bothersome. Not all bothersome behaviors are inappropriate. That is to say, a 10-year-old, for example, who wakes up crying with a fever at 3 o'clock in the morning, this may be very bothersome to us as parents in the middle of the night, but their behavior is in no way inappropriate. Not all bothersome behaviors require intervention, and not all inappropriate behaviors are problematic. If we saw 2 6-year-old friends who wanted to greet each other in church and they yelled and ran across the church and hugged each other, this might be inappropriate for that setting, but with simple instruction, it should not become a problematic behavior. So as you can see, before we address behavior, it's helpful to decide if it's appropriate, inappropriate, problematic, or pathological. Once we've acknowledged these 4 arbitrary categories, and they are arbitrary, I'm just doing them for a way for us to communicate tonight, we can ask the question, how can we tell the difference? At this point, it's important to try to understand what criteria can we use to differentiate between them. There are several factors to consider. First of all, is the behavior developmentally appropriate? That is to say, how many other children of the same age, developmental age or chronological age, manifest this behavior. Every family, community, organization, and subgroup has a culture. So we ask the question, is the behavior culturally appropriate? In order for a behavior to be inappropriate, we have to be sure that the child has not learned or been taught to behave that way in the culture that they were raised. Another important question, is the behavior appropriate for a certain environment or setting? Behavior in the classroom certainly comes with certain different expectations than the behavior that the child would be expected to have in a gym or out on the schoolyard. And to continue, is the behavior a reasonable response to some specific precipitating events? Oftentimes in a clinical setting, as we question situations and certain behaviors, we find out things like the child has just moved, or their house had a fire, or there's been a death in the family. And these kinds of precipitating events oftentimes change the way we conceptualize whether a behavior is something that needs to be addressed clinically or is something that may be a more appropriate or maybe an inappropriate but not necessarily problematic response to situations. Does the behavior prevent the child from realizing their own goals or establishing healthy goals? Is the individual able to control the behavior? Is the behavior safe? Is it legal? Are there critical limitations, for example, medical or cognitive or neurological limitations that may prevent the child from behaving differently? Are there extenuating circumstances, such again as grief or transition? These are all questions that help us in trying to differentiate whether or not the behaviors that we're observing are of a more serious nature. These considerations may seem somewhat complicated, so I can offer you a simple functional distinction that we oftentimes use in a clinical setting. We'll call that the DIF, differentiating behaviors. The three factors that we most frequently look at are the duration of the behavior, how long does it last? When a child has a response to a particular situation, if they can address that behavior and overcome that response more in an appropriate way in a matter of minutes, the duration is very short. We oftentimes don't see that as a problematic behavior. How intense is the behavior? Individuals who have very intense, overreactive responses to situations, that may be indicative of a situation where treatment is looked at as being more probable. Third consideration is the frequency of the behavior. Is it something that happens every day? Is it something that happens more often than not? Is it the only response that the child has to frustration or to difficult situations or situations that make them unhappy? As a parent, for those of you who are listening who are parents, there's a question that I've come up with over the years that is very helpful when you're trying to understand a teacher's reaction to your child's behavior. This is something that we have to do when we're in the educational system. We have to provide parents with information about their child's growth. And so oftentimes the teachers follow a fairly systematic paradigm where they will, on parent-teacher night, tell you the child's strengths first. Usually tell you that your child's a nice child and how much they like having him or her in their class, and go on to tell you that they're doing a nice job in terms of getting along with their friends and reading and so on. But at the end of the conversation, almost invariably, the teachers feel a necessity to mention some kind of weakness and something that can be improved. And oftentimes I've had referrals from parents who have come to me and said, well, the teacher said, and then go on to proceed to tell me what that weakness was. And so over the years I've come up with a question. I call it the best question for parent-teacher night. And that is, when you're in that kind of environment, and a teacher says to you, well, I think your child is doing wonderfully, but he could do a little better in reading. Well, does that mean he has a reading disorder? Does that mean that he's having difficulty and failing? Does that mean he's potentially in danger? Or does it mean that he can just do a little better? The question that I've come up with is very simply, how does my child compare with the rest of the class? And by asking that question, what that allows us to do is it allows us to get a range. And so if there are 25 children in the class and the teacher says, well, you know, there are 4 or 5 kids that are reading better than him, but he can still do better. He's a really bright boy. I say then that's not a serious behavior that we need to address. On the other hand, if they say, well, you know, he really is the child in the class who's having the most difficulty, then that speaks to me and I have a better understanding. If she says, well, you know, about half of the class is doing better than him and half of the class is not, then I have to make a decision in terms of what I think is problematic and what's not. But that question, I think, will help parents oftentimes to just be able to address things in a way that might be a little bit more comfortable. Okay, so to sum up this portion, let me say that it's not enough to simply recognize that a behavior exists. It's important to determine how severe the behavior is before initiating interventions. So again, appropriate behaviors, looking at the hierarchy, these do not need treatment or intervention. Inappropriate behaviors may need interventions or treatments, but not always, and it just depends on a case-by-case situation. Problematic behaviors oftentimes do need treatment and or interventions, and it's important to be on top of those to address them. If they resolve quickly, then we know everything is okay, but if they don't resolve, then we sometimes move into pathological behaviors that absolutely need to have some treatment or intervention. In tonight's discussion, the plan that I have prepared to present to you can be used in all of these, but I want to be careful to say that when your behaviors, the behaviors you're dealing with become more problematic, or certainly when they're pathological, it's very important to get professional advice in terms of the nature of the behavior, the seriousness of the behavior, and what should be done best to address the behavior. Okay. So I'd like to move on to just some theories for understanding behavior. In this section, I really simply want to build the case that I just want to review some of the prominent theories related to how we conceptualize behavior and just build the case that there are many different ways to look at misbehavior. So in order to do this, we're going to present to you a questionnaire that we would like you to take a minute to answer. We're going to look at the little girl in the car seat and ask the question, why is she crying? Her hectic parent that morning hastily dressed her for preschool, whisks her off into her car seat, and all the while the child is crying hysterically. Why is she crying? I think at this point, Kelly, can we put the questionnaire up?
I can. I had to call it down to 5 answers, however, so
Okay.
So it has been launched. I will give everybody, about a minute to answer. So is she afraid of being separated from her mother? She woke up feeling sick. She's a sensitive child and always cries when she's upset. She's the youngest child and her siblings cry. So does she. Or I don't have enough information to make a assessment. Okay.
So for those of you listening, if you can enter your responses,
It looks like most of you have responded. We've got 77% who have voted. I'll give it a couple more seconds and then I will close the poll.
In this election season, this is certainly appropriate.
All right, I'm closing the poll and I will share it with you when I am done. So most people said there's just not enough information. 5% said she's afraid of being separated. We have 7% that said she's sensitive and always cries, and 2% that said she woke up feeling ill.
Okay.
I'm going to
Can you
hide it.
repeat those one more time for everyone so that we can just give them the rundown again?
Sure. 5% said she's afraid of being separated from her mother. 2% said she woke up feeling ill. 7% said she's a sensitive child and always cries. And 86% said they didn't have enough information to know why she's crying.
Okay, thank you. And indeed, there is never enough information from this kind of scenario because there are so many variables. And this is the point that I'm trying to make. There are many different ways of understanding behavior. So someone with a psychoanalytic or psychodynamic point of view might say that the child was crying because she's afraid of being separated from her mother. A behaviorist indeed would say that this is a learned behavior, that it's a conditioned response. Every time the child cries, mom stops and gets her donuts. Or if she cries hard enough, mom will take her home. There's the biophysical, which says the behavior is organically determined or inherited or a matter of temperament. We have the sociological point of view. It's a behavior that is within her core group, her siblings, her culture. The ecological view, which is an interaction of conflicts between internal and external forces, or the constructivist view, very similar, which says it's a complex interaction. All of these are very well researched and very well established theories of behavior and ways of trying to understand behavior. But the point that I'm trying to make here very simply is that the way we look at behavior influences the way we address it. And so we all have our theories. We all have our assumptions, our beliefs, and our biases, whether they're conscious, unconscious, or subconscious, and they influence our perceptions, and consequently, they influence our responses to the situations. So what I'd like you to do for just a moment here is reflect on your own thought of your personal theory of behavior. Maybe answering these questions could help you to understand some of the biases that you might have. I believe that people behave the way they do because. I believe when a child misbehaves, it's because. Or if you want to make it a little more concrete, I believe when my child misbehaves, it's because. Or if you want to make it a little, or in a classroom, about a specific child, I believe when that child misbehaves, it's because. And a third question, I believe the best way to change behavior is. And the answer to the third question is often a reflection of the biases that we have in addressing the other two. Okay, as we move on, I'd like you to think about some principles that I'd like to put forth about behavior management. Okay, well, number one, if nothing changes, everything stays the same. This is my facetious way of coaxing people to try some things that they may not at first be comfortable with. If we've been doing something and we continue to have a behavioral problem with our children or the children in our class or the children in our practice, and we haven't made any impact, well, then we have to change something. If we don't change something, we're not going to get different results. Behavior has a purpose. Behavior that increases is being reinforced. Even negative reinforcement, like hollering and punishing, can be reinforcing to a child if what the child is looking for is attention. And it's often difficult to communicate that. Parents will often say, you know, I don't understand it. He gets punished. He gets things taken away from him, or I yell at him and he's still doing it, and sometimes he does it more. Well, what we understand about behavior is that when behavior increases, something is reinforcing that behavior. The shortest distance between 2 points is a straight line. That's my geometric principle of behavior, which is simply to say, sometimes if you have misbehavior, especially if it's simply inappropriate behavior, the best thing to do is just tell the child to stop. Always try that first to tell the child it's not acceptable. It's amazing how many times in a classroom setting I've seen situations where until the rules were set down clearly, the child continued to misbehave, but once they did and they knew what the consequences were going to be, the behavior did not continue. Behavioral change is best achieved by a system of both rewards and consequences, and we'll talk about this a little bit later on when we talk about the model for a behavior management plan. Pre-negotiate. This is an important principle of behavior management. Don't wait until a behavior has gotten to be a serious problem. Once a problem is detected, pre-negotiate the rules, pre-negotiate the outcomes, and we'll talk again about this as we go on with our plan. Take yourself out of the middle. This is going to be an important principle that I like to foster for parents especially, but in any behavior management circumstance. When we put ourselves between the child, when we put ourselves between the rule and the consequence, then we as individuals can oftentimes be the distractor for the child. So that means if I say, this is the rule, and then the child breaks the rule, and I'm the monitor of the rule, and I impose a consequence, then oftentimes that's seen as me punishing the child. Whereas if the rule is self-reinforced by the consequence or the reward, then the child sees that that's an outgrowth of their own behavior and not what I'm doing to them. Number 7, let the rules reinforce themselves. Forgive my numbering order there, something went wrong. Number 7, let the rules reinforce themselves, same principle, and keep the responses close to the behavior. Never take away an earned reward. Again, further explanation later, but once a reward is given, if you take that away, you take away the incentive to keep trying, because what I did to accomplish that was lost. And now that my reward has been received, and I'm proud of that, and I take that away with me, and you take it away from me, the next time I might not even try. So this is a motivation-related principle. Consequences need to be meaningful, as immediate as possible, and short-lived. Consequences are superior to punishments, and we'll explain the difference in a little bit. Involve the child in the process and be consistent. Be patient. Be proactive, not reactive. Understanding lends to a greater variety of interventions, and I encourage you to try to look at behavior from a lot of different perspectives to try to figure out what's going on and why the child's doing what he's doing, and understand it as best you can. Intrinsic motivation is superior to extrinsic motivation. We can force a child to do just about anything. They can be coerced, but that as soon as you take away that motivator, as soon as you take away that supervision, the behavior stops. And so the goal is not simply to get the child to behave properly, but the goal is to get the child to behave properly for reasons other than us monitoring them. Changing behavior without changing the brain produces short-term results at best. And so in our systems, we want not only to be able to get the child to act differently, but we want to change the way that they think about what they're doing so that they can be better motivated to do things in a way that will make a difference. Okay, so now to get to something a little more concrete, we'd like to look at a model plan, and in order to do that, I'd like to explain to you the goals of the plan that I designed. This is a plan that I've designed over the years. I got away from charts and tickers and star charts and things like that, which are just too cumbersome in most situations and oftentimes don't get followed through. I tried to make a plan that would be pretty much self-supporting once it was designed, and that could be easily modified. It can be used in the home. It can be used in the schools. I use variations of this in my clinical practice. So the goals of the plan: to take the parent out of the middle, or to take whoever is reinforcing the rule out of the middle and reduce conflict. We want to not replace problematic behavior with oppositional behavior, and so as long as we stay between the rule and the consequence, we can become the target of the child's emotions, and that can cause other complications that just make it more difficult to address the behavior that was the problem in the first place. A second goal of this plan is to empower the child so that they can achieve their goals without acting out. This is so important. Why does the 2-year-old who is in the shopping cart at the supermarket cry for the cookie? Well, I'm sure you each have your own theory of that one too, but my answer to that is they cry because they can't ask for a cookie and get one. And so the child's only problem-solving technique is to cry. Sometimes when they cry, they get a cookie. Sometimes they don't. If they never get a cookie, they probably will stop crying for the cookie and find some other way to negotiate. But since they can't simply say, "Mom, can I have a cookie?" they feel powerless in that situation and they act out. We see this same tantruming behavior all throughout adolescence and even in some adults. So what happens is we want to empower individuals so that they can negotiate for the things that they want, provided those things are reasonable, and that they can have an opportunity to have some input into the outcomes. A third goal is to encourage the child's ownership of their own behavior. This again has to do with the parent not being the one who monitors everything that the child does. We want to encourage the child to take some ownership in setting the rules, in finding reasonable consequences, and accepting those consequences when they break the rules. And of course, getting the appropriate rewards when they do what is appropriate. A fourth goal of this program is to give the child a stake in the rules and goals and their outcomes, and I think I just pretty much covered that. 5, we want to increase the likelihood of permanent change by internalizing motivation so that it's not simply done. They're not only doing what we ask them to do when we're watching over their shoulder. 4 P's I've developed for you for setting up this behavior management plan. First of all, prepare the plan. One of the biggest complaints I get from young people when they come into my office and there are conflicts over behavior in their family is that they feel mom or dad has 100 rules. So when we go to the children, we don't want to, with a plan, we don't want to go with a plan piecemeal. We don't want to say to them, today I want you to clean your room, and tomorrow I want you to pick up your clothes, and the next day I want you to do your homework without supervision, and each day come up with something new. Instead, take some time, prepare the 4 or 5 or 6 primary concerns that you want to address at this time. Don't worry about fixing everything at one time. Identify those behaviors that need to be addressed and prepare a comprehensive plan that can be presented in a way that the child will then be able to look at that plan and say it's not overwhelming. Be proactive. Whenever possible, anticipate the problems that are developing and make a rule and set the rewards and consequences proactively. That is, do them in advance. This is an important construct, and I may address it a little more later if I have time, but basically the difference is that when the difference between a punishment and a consequence is that when you're proactive, the child sees that as a consequence because you've pre-negotiated our next P, you've pre-negotiated what the expectations are, and the outcomes are the result of the child's choice. When you're reactive, that's when we haphazardly respond to what a child is doing. And so on a good day and we're in a good mood, the child may get away with a little more. On a bad day, we're in a bad mood and the child gets stopped abruptly or the consequences get accelerated or exaggerated. So by being proactive and pre-negotiating with the child, we're able to create an environment where it's consistent. What's expected is known and it's consistent, and the child has to take accountability for their own choices as to whether or not they want to comply with the rules. And finally, the fourth guideline is to be patient. These things don't change overnight. You must apply a program consistently, and you must look for small gains as progress. One of the things at this point that you might consider is some kind of baseline information. Baseline means simply what is the behavior that's concerning me, how often does it occur, how severe is it, how long does it last, again using our DIF kind of approach. And by doing that and getting some baseline, so how many times this week did you have to conflict with your child over starting and finishing their homework? If it's a daily event, and next week after implementing a behavior management plan, it cuts down to 4 days, and the week after that to 2 days, or we only get it to 2 days and it stays at 2 days for a while, at least we've made progress. And then we know to readjust the plan. So be patient with the plan. Don't give up too fast. All right. The plan that I've developed has 3 simple components. First component is to develop rules and goals. The second is to develop rewards. And the third is to develop the consequences. What you're looking at before you now is a sample of a plan that I use and share with families consistently. The first column is the problem column, and there I usually just make notes or ask the parent to make notes about what the problem is. When I eventually share this plan with the child, which is after we have prepared the plan thoroughly, when I eventually share it, I drop the problem column and just focus on the others. The rules, well, let's go through this a little more systematically. So the first section is rules and goals. I make a simple distinction here. Rules are different from goals in this conceptualization in this way. Rules have to be complied with, whereas goals are encouraged but not required. An example would be you have to do your homework. You have to take a bath. You have to clean your room. Goals would be something like if summer break was approaching and I wanted to encourage my child to read a novel over the summer, or learn a bit of a foreign language, or participate in a particular activity. So I would set that as a goal rather than a rule. So rules have to be complied with, goals are encouraged. Both of them should be positively stated. Both should be stated in behavioral objectives. A behavioral objective means that when I state a rule or a goal, it means that I state it in such a way that the behavior that is observed can be observed by you, by the parent, by the teacher, by the neighbor next door, by the mailman, and everybody would agree it's the same behavior. So for example, if the parent said to me, I would like my child to be kinder, I would say that's not a really good rule. And the reason I would say that is not because we don't want the child to be kind, it's because I can't operationally define the word kind. And so when the child's interacting with their sibling and I'm the parent and I see that behavior and I say, you're not being kind, and the child turns to me and says, I am being kind, there's no real way to negotiate that or to determine what the solution to that is. And so we have to define it in a way to say, I want you to be kind to your sibling, meaning I want you to spend at least 10 minutes playing with them before you walk away and go to your room. And by doing that, either they spend the 10 minutes with their sibling or they don't. And that way we can all objectively tell whether or not the behavior was complied with. Now, those things are all similar, and then, but finally, rules have both rewards and consequences, and goals have rewards but no consequences, and therein lies the distinction. So rules are things that you have to do, and there's going to be a reward if you do it right, and there's going to be a consequence if you don't. Whereas goals can have rewards but no consequences. Okay, let's talk a minute about rewards. Rewards should be meaningful to the individual. They should be given as soon as possible, and they should never be taken away. The way I establish rewards when I do a program like this is I ask the child what they would like to earn or what they would be willing to work for. And oftentimes examples might be things like a special dessert, a later bedtime. Very often, it's amazing how often children will say, I want to spend more time with mom or dad, reading a book, playing a game, going to breakfast. There are so many things that are non-material that children respond to just in terms of relationship that are oftentimes motivating for kids. Extra time on electronics is another thing. Rewards, and for those of you that want to try developing a system like this, rewards can be pooled. So this makes it a little bit easier. Rather than having to come up with 100 different rewards, you can usually take 5 or 6 rewards and throw them into a pool, and when the child does things right, you can say you can pick from that pool. Now, the important thing, though, is that we try to match rewards and consequences to rules and try to at least have some variability so that we're not giving and taking away the same thing, which brings us to consequences. So consequences also should be meaningful to the individual. It has to be something that is going to make a difference. If your child has 10 electronic devices and you say I'm going to take away one of them, that's not going to be very effective, at least in the short term. The important thing about consequences in my theory is that they need to be short-lived and generally speaking not cumulative. There are some exceptions to this, but overall it's essential that you don't have consequences that just keep getting longer and longer and longer. Short-lived meaning if you break the rule today, the consequence is imposed today whenever possible. And tomorrow is a new day. You can start again, and we can work at your learning the behavior that we want, not a punishment. Punishments are usually longer lived and oftentimes outlive their effectiveness because the child is no longer relating the punishment to what he did, but rather simply to mom or dad are just punishing me. And consequences, for the most part, should be different and specific to each rule, so that if you give a consequence for one rule, you can't. It's very difficult to have the same consequence for another rule because then you're adding one on top of the other. And for example, if the child lost bedtime, a privilege, meaning that they went to bed 15 minutes early tonight because of a misbehavior, you would not, if you had that same consequence for another behavior, then you would just be adding minutes upon minutes upon minutes, and at some point you will not be able to be consistent in applying those consequences. So some examples of consequences might be timeout, reduction of loss of specific privileges, extra chores, no privileges until the rule is complied with. This is one of my favorites. For example, giving the child a deadline, saying something like, I want your room cleaned once a week by 12 o'clock on Saturday afternoon. And so by 12 o'clock every Saturday, the room has to be cleaned. The consequence for that, and a very effective consequence for that, is if you don't clean your room by 12 o'clock, you have no activities until your room is clean, meaning you can't go out, you can't play your electronics, you can't watch TV, you can't talk to your friends on the phone. Especially with adolescents, oftentimes this becomes self-reinforcing because all I'm trying to do is get them to clean their room by 12 o'clock. And so if they decide they don't want to clean their room all day, then they're just going to be restricted from any of those activities that they want to participate in. And eventually they get the message to comply or otherwise deny themselves. Okay. Again, I just wanted to highlight some of the differences between consequences and punishments. Consequences are agreed upon. It's so important to pre-negotiate, to say, if you do this wrong, let's come up with something that's fair and agreeable that will be an appropriate consequence. Again, those of you who may have a very difficult situation, like an oppositional child who is more pathological, then you may say, well, he's not going to agree to anything, or she's not going to agree to anything, and there may be truth in that. And I want to apologize again and say this can be applied to all levels of difficulty of behavior, but when you get into that realm, it's very important that you consult with someone that can help you to fine-tune and make other changes that are going to be very specific to that situation. So consequences are agreed upon, punishments are imposed. Consequences are proactive, punishments are reactive. Consequences are pre-negotiated, whereas punishments are more arbitrary, and the child gets the feeling that you're just making this thing up as it goes along. There's no consistency, and it loses a lot of its power when the punishment is arbitrary rather than having a pre-negotiated consequence. Consequences are consistent, punishments are inconsistent. Consequences are self-reinforcing, whereas punishments require an external enforcement. And finally, the goal of consequences is to try to accomplish the intent of the rule, whereas the goal of punishment is oftentimes at least interpreted as unrelated to the rule and simply something that you're doing to me. Okay, so if you're going to develop a behavioral plan, first thing you should do is identify the problem and then the goals and the rules. Make a rule or goal for each problem. Determine the appropriate and different consequence for each rule and goal, and identify meaningful rewards for each rule and goal. Again, remember to ask the child. Meet with that child at that point. Once you have conceptualized the plan, if it's a family plan between you and your spouse, or if it's a school plan, once you as a teacher have conceptualized the plan, then meet with the child, present the plan as a package, and solicit their input. Listen actively at this point to their reaction. Watch their body language. Listen to the input that they make, and try to make reasonable adjustments. If they say that's really going to be hard or that's too harsh, listen to what they say and try to negotiate a consequence that is going to be acceptable to both of you. Implement the plan consistently for at least 2 to 3 weeks so that you can start to see whether or not it's making any sense and it's working. And finally, monitor the plan and make adjustments as needed. Okay, for those of you that are from the schools, those of you who are educators, I just wanted to throw this up as an example. You're going to have access to these slides, I believe, and so therefore you can copy anything that's in here. This is a little more complicated plan. I would not advise parents to use this at home. It's much too much work. The other plan that I designed is pretty much something that can be put into place, and you don't have to work at it continuously. But for teachers, this is more of a functional behavioral analysis and FBA, and what it does is it talks a little bit more about the antecedents, what happened before the behavior occurred. It talks more about the expected levels of achievement and how you're going to evaluate it, the evaluation method. It also gives you a place here to develop the plan as a team, so that you can get some team input into how to work with a child. And I find something concrete like this in the schools is oftentimes helpful. Just a little graphic to talk about, again, in the schools. You can do some of this at home. I wouldn't make it too formal, but it's always good to have some baseline. Figure out what your target behavior is. Look at the baseline measurement. In other words, how often is this occurring? How serious is it? How much of a problem? How long does it go on? Then develop your interventions, what you're going to use to address the problem. Finally, do some post-intervention measurement, which is the same as your baseline information, only you do it after you tried something, and see how it's working. Go back and look at the behavior again and see if the behavior has been changed or modified or improved in any way. Okay, so if you're going to implement the plan, remember, be patient, be consistent, review effectiveness every 2 to 3 weeks to see if the behavior has improved, and tweak it as needed. And after about 6 to 8 weeks of consistent improvement, a rule of thumb is that you can often discontinue reinforcing that particular behavior and substitute another if needed. And if the behavior re-emerges, then go back and put it back into the plan again. All right, this is there again on the slides. There are just some books and resources that you might want to look at to get some additional ideas, some online resources, and some books and services. And finally, I just want to leave you with a parting thought as we think about the kids that we're working with, whether they're our own children, grandchildren, whether or not they are, whether they're in our classroom or in our clinical practices. And I'm always impressed with these words from Louis Pasteur, who said, "When I approach a child, he inspires in me two sentiments, tenderness for what he is and respect for what he may become." And I firmly believe that with the proper interventions and proper interactions and taking away some of the tensions in relationships related to behavior, we can help our children to behave in appropriate and positive ways without having to create undue stress in our families. So I want to thank you for participating in this webinar, and I think at this point we're going to just turn it back over to our moderators for questions, and I will try to answer questions as they come up.
All right, I think we're good to go. You can hear me okay?
Sure can.
Okay, great. I have a question about goals. So, if achieving goals doesn't result in encouraging consequences, such as rewards, why would someone aspire to achieve them in the first place?
Well, I'm not sure, maybe I didn't make that clear, but there should be rewards for goals, just not consequences. So we do want to reward that kind of behavior. We want to encourage it. We want to give an incentive. And so it's not that we don't want to reinforce goals or reward goals. It's that we don't want to punish or have consequences for goals when it's something that we want the child to do that's not absolutely necessary to be done. It's more of an enrichment, if you would conceptualize it that way. And so in doing that, we want to encourage kids to accomplish things, but we don't need to have a consequence when they don't.
Okay, so the example you gave about the goal was reading, one of the examples you gave was reading the book over the summer. So if a student doesn't read the book over the summer, there's no real consequence to that. But if they did, then there could be some special
reward or incentive.
For incentive for having done it. Okay. Yep. But otherwise it's not a problem. Okay.
Yep. So if I'm a dad and I want my kids to, if I want my kid to get better at shooting free shots in basketball, I can use a punitive approach and tell him if he doesn't go out and practice every day for an hour, he's going to be punished in some way. But if I do that, I'm likely or more likely to develop resistance to the activity or have him only do it out of compliance. Whereas if I encourage him and say, for every half hour that you shoot baskets, you and I will spend, we'll spend a half hour together doing something that I know you enjoy. We're much more likely to get the same positive behavior, but getting it without all of the emotional overlays.
Okay, perfect. Good example. So, behavior plan. I have a question about designing a behavior plan for high school students that have anxiety about coming to school. And in this particular case, apparently the parents do not want to seek outside help, so there's no consideration of medication for this student. So could you address that?
Yes, that's a great question. And if we're talking about a behavior plan for a school for a child in school, then we're talking about resources that are available even without the parent involvement. So there should be a counselor and a school psychologist that can at least make some types of interventions with or without the parents' involvement. Sometimes the parents are cooperative and sometimes they're just not there. And if that happens to be the case, they're not interested in seeking, those individuals or the school child study team or pupil support team should triage to come up with an overall plan. Now, as far as specifics are concerned, um, one of the most important things with school avoidance behaviors is that we don't allow that behavior to get worse. Anxiety disorders are of the nature, and this is something we can't go into great detail on tonight, but anxiety disorders in general are of the nature that they're self-reinforcing. In that regard, they're very different from mood disorders and other kinds of disorders, meaning that when a child or when any individual has an anxiety and they avoid the situation that they're having anxiety about, then that individual, in turn, by avoiding that situation, they will either have some visceral feelings, some physical feelings, they'll have some thoughts and emotions, and by avoiding that situation, it becomes even more fearful. The more they avoid it, the more the anxiety grows in strength. And so it's very important not to allow them to avoid school by, say, staying home or going on a homebound program. It's very essential that you get them into school, even if you're going to use something like what's called successive approximations, where maybe the child can come into school and sit in the counseling area, or come into school and sit in a room with the monitor by himself. Depending on what the specific nature of the problems are, it could be peer interaction, social anxiety, it could be a lot of factors. So in designing that, the most important thing is to determine, is to make a decision not to allow the child to avoid the circumstance, and then to develop a program that addresses his discomfort in that situation. And so it could be that you're going to have him come to school perhaps in the beginning just for an hour a day, and then increase that gradually. But today there's a tendency to want to kind of immerse people with anxiety dilemmas like that in the situation even more so. I'm a little more comfortable with doing it gradually and easing them in. But again, keeping in mind that when you have a child with school avoidance, if you let him not come to school, you're simply reinforcing his fear that there's something there, some reason that he shouldn't be there. And so it's very important to start by communicating with him that being there is a necessity. Now, in short order, there are certain things that have to be complied with. And it's very important, again, to go to him or her and say simply, school is a requirement. Even your parents have restrictions that they have to get you to school, and so we want to do everything we can to get you there. We're going to support you, and pre-negotiate with him what would make him comfortable. What can we do to get you here for 2 hours a day? Where would you like to sit? Who are you comfortable being with? What kinds of activities would you like to do during that time? That's a lot of bending, I understand, for that individual, but we have to understand we're talking about somebody who's already at a most extreme behavioral state where they are actually cutting themselves off from all age-appropriate contact at that point. So we have to make accommodations.
There's another, thank you on that, but there's another question that we got too, having to deal with anxiety also with a high school student, and it has to do with apparently some medical professionals that didn't elaborate here what kind, that have just apparently written a note excusing the child or children from school due to anxiety, but with no plan, I guess, for how to solve the school piece. So that's so how do you deal with that? It would seem to me that child might need to see a different professional.
Well, and I wouldn't be, so quick to judge what the basis for their recommendation. Oftentimes, especially the medical profession, MDs are about easing pain and treating us with treating our symptoms. And so that might be, from their perspective, that might be a short order kind of solution. I think the important thing then, and again, we're talking about a most severe type of behavior when we have school avoidance, and involve a mental health professional, and for that professional to dialogue with the medical doctor. But even though the doctor may say that the child can be excused from school, it doesn't mean the school has to develop a plan that accepts that. there may be some issues there, if the parent's resistant, and that's a different dilemma. If the parent wants to keep the child out, but if, with the proper attention given to the situation and good dialogue with the parents to help them understand what your plan is, if your plan's thoroughly thought out, you can develop a plan that then everyone will agree is in the best interest of the child. And in most cases, I think when I'm reasonable with a parent and say to them, listen, what's our goal here? Would you like to see your child never go to school again? I think most parents at that point are willing to acknowledge, of course not. I want to see him get back in school and be healthy. And when that occurs, then we have a common point and we can start to work from there, despite what one individual might say. And again, I don't think it's necessarily that the doctor might have been ill-intentioned. I think it's simply a matter that he was trying to relieve the child's pain at the moment.
Okay, fair enough. I've had a series of questions and from one individual who's listening, but I don't know that we could get into all of them. But one of the questions has to do with this student. So this student, let's see, is 15 years old. And apparently he likes negative attention. And so the parents have tried rewards and consequences and nothing seems to be working. So could you talk about that a little bit in that situation with the 15-year-old who seems to enjoy that negative attention?
Yeah, and again, without all the specifics, not knowing all the specifics of the situation, but when you have an adolescent who is drawing a lot of negative attention to themselves, my first question is, what are you trying to accomplish? In other words, there is a motive behind that behavior. I don't know what he wants, but he wants something. Again, it could be something related to the family situation, an absentee parent that he wants to get more attention from. It could be simply that he never has developed good skills at being rewarded for the things he does well, so he does things badly and gets a lot more of attention that way. But I think that's where you have to intervene with the child, and you really have to try to with their cooperation, come to the simple question of what is it that you want to accomplish. And rarely, I've had only one case in my entire career where there was a child who I could not find a motivator for. There was nothing that would motivate this child. This child had been denied and deprived so much that he simply said, I don't want anything. There's nothing that you can do, nothing you can give me, nothing that I can work towards. And that was one person out of thousands over 40 some years. But most children, most adults, if you say to them, what is it exactly that you would like here? What can I do? So we have an adolescent. There are always things that are important. Adolescents have needs when it comes to clothing, when it comes to their appearance for their friends. They have needs when it comes to getting their driver's license. They have needs when it comes to having money to go out with their friends and socialize. There's always something the child wants. Unfortunately, in our society today, we give a lot to kids, and we don't realize that sometimes we give so much that they don't need to, comply. And so it is important sometimes to pull back a little bit and say, listen, we're going to go to a zero basis here. We certainly are required to give you basic shelter and food and clothing, but you don't need those $100 sneakers. And, I'm not willing to give those to you. If you want those, maybe you can earn them. And if I see some compliance and behavior, maybe we can talk about ways that you can work towards those things that you want. And this is a dilemma. So I think with the adolescent who's getting negative attention, we have to ask not the question. See, don't focus so much on the behavior itself, the negative attention seeking, but focus on the motive. What's he trying to get? What's he want?
There's a theory of kind of making kids earn things instead of having them get them automatically. So you kind of strip them down and then they earn the iPhone or they earn the tablet, or they, instead of giving it and then taking it away. Is that
Hmm.
an approach that you have done any work in that area?
Well, again, maybe it's just semantic language. Maybe it sounds like it's just semantic language, but to me it's not. It's really the relationship interaction. So it's not about giving and taking away, because that puts me again into that control position where I'm the good guy or the bad guy. Instead, it's helping them to recognize there there are no, you don't have anything automatically coming to you, that there are only basic things that are yours just by right of being my child or being in my classroom or whatever, and that beyond that you have to demonstrate behaviors that are mutually acceptable. And so then there becomes a bit of a quid pro quo, or a bit of a social interaction that says, I respect myself, I have boundaries, and there are things that I need from you just as there are things that you want from me. I'm more than happy to interact with you and negotiate on those things, but it can't be simply one direction where you make a demand, you engage in a certain behavior, and then I in turn just give, give, give. And so it's not really taking away, it's really saying to them, none of this, it just comes to you automatically. And
Okay.
that's your choice. In other words, would you like to earn? If you translate that into adult behaviors, your boss is going to give you certain privileges, benefits, financial compensation for things that you do. You don't just go in and say, I want a check. So he says, you'll get a check and for doing these things. And it really becomes, it's a relational kind of thing. It has nothing to do, it's redefining the parent-child relationship. And for those of you that are listening that, I apologize I didn't have more time to talk about this, but parentified behavior simply means I'm the parent, you're the child. At 2 or 3 years old, that's appropriate to say to a child, put your coat on, we're going to grandmom's house, we're going to the store, get in the car, let's go. And those are the kinds, that's the way we talk to 2, 3, 4, 5-year-olds. As kids start to get into 8, 9, 10 years old, we start to plan ahead, and we say we're going to go to the store in 15 minutes, make sure you get your work done. And with teenagers, we have to get to more what we call an adult-to-adult relationship. But an adult-to-adult relationship has reciprocity, which means that not only do we do, but not only do we respect you as being more adult, but we expect from you more responsible behavior, and it has to go both ways. And so that kind of thing, it's a shift in the way you relate to the child. If you're going to continue to be top-down, superimposed, authoritarian, at some point they're going to outgrow that, and you're going to be ineffective.
All right, I think we have time for one more, and this is from an educator, and it has to do with helping a student, or how do you help a student who has apparent panic attacks every time he has to take a test. Now, this child is 8th grade, he's 14. He cries, he throws his glasses and other objects. So the teacher is wondering if he's being manipulated by the student, but they try to calm him down, but it's just, what would be your suggestion in this case?
Yeah, well, panic attacks are real. Panic attacks are pathological. Panic attacks are debilitating. And so the real question there is it a legitimate panic attack? The question that the teacher is asking is it a legitimate panic attack, or is the child being manipulative? And I think in order to answer that question, you really need to have a diagnosis. You need to have someone clinically look at that child and make a determination whether or not this is genuine panic, and not assume that he's just trying to be manipulative, because panic is a very serious condition. That being said, what can the teacher, well, the teacher themselves, and I'm sure the teacher who asked that question knows this, so I'm not trying to be redundant, but the child study team is there whenever you have a child of this nature to try to provide help, diagnoses, and a behavioral plan and or an IEP, an individualized educational program plan to help that child. As far as the teacher themselves in the classroom, what can I do for that child? I'm going to go back to my my continuous rant, which is to be proactive and talk to the child. We know that you get nervous. We know that you're here. You're getting treatment outside, or the team is going to help you and try and come up with a plan. But in the meantime, what can I do to ease some of this for you? What would be more comfortable? Would it be more comfortable if you took the test in the counselor's office? Would it be more comfortable if I allowed you to take the test after school? And by having that dialogue, what you're doing is you're giving that child empowerment, which in turn is one of the major treatments for anxiety, so that the child doesn't feel trapped. When an individual feels trapped, anxiety levels escalate rapidly. And so by giving that child options, allowing them to take some control of the outcomes, what you're doing is you're providing for them some ownership, and you're giving them some power in that situation. And that would be my best recommendation to the teacher. It's really three-pronged. Get a professional diagnosis, refer to the child study team, and if you're, in the meantime, I understand that the teacher is probably stuck with the situation until these things get moved. Dialogue with that child and see if you can make accommodations that are, of course, not overbearing for the teacher, things that you can't manage.
You can do,
but you got to be able to do it. But we're not asking teachers to make accommodations that are beyond what they can easily effectively do. They have a class to deal with, but accommodations that might help that child to just feel better.
It would seem that that kind of behavior would be demonstrated other places too, besides the classroom. So it would seem that there would be triggers maybe at home that parents would see regarding that behavior.
Yeah, and that's why a more holistic approach where a team is involved, and that it certainly includes the parents, is essential to dialogue, so that people can talk together, get a handle on what's going on, and find out if he's just trying. And I would talk to other teachers, of course. I don't get the sense from the question that the teacher really thinks this kid is simply manipulative. I heard a sincere question as, could it be manipulative behavior? But yes, if every other class the kid goes into and takes the test and there are no problems, then I would be a bit suspicious.
Yeah. Well, there's probably way more to this story than we've gotten in that one question. But I think we're going to wrap it up here. Doctor, thank you very much. A lot of great information. I'm going to turn this back over to Kelly for a wrap-up.
Thank you.
Thank you all for joining us on our webinar for behavior management. There is an exit survey which we need everyone attending to fill out. The webinar blog is open now and available for the next 7 days on the NJCTS website. For any additional questions that we did not cover in tonight's presentation, that website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to our website shortly. Our next presentation, Charter Schools, Understanding Your Child's Rights, will be presented by Rebecca Spar and is scheduled for April 13th. This ends tonight's webinar. Thank you, Dr. Buonadonna, for your presentation, and thank you, everyone, for attending. Good night.
Good night.